Greetings, I am Dr. Channing Moreland, the Director of the School of Health and Rehabilitation Sciences Wellness Pavilion, located at the Homewood Community Engagement Center. The Wellness Pavilion is a student-led community space that offers person-centered interprofessional services and programs across the lifespan. Our goal is to promote, improve, and maintain the health and wellness of the residents of Homewood and surrounding communities. Today, we will be presenting an interprofessional community-based diabetes education program called DISCO, Diabetes, Intervention, and Self-Care Opportunities. The program will be led by the University of Pittsburgh faculty and students from the School of Pharmacy and the School of Health and Rehabilitation Sciences, Department of Physical Therapy, Department of Sports Medicine and Nutrition, and the counseling program.
Hi, I'm Dr. Laura Dietz, faculty member and one of the clinical coordinators with the Pitt Counseling Program.
And I'm Peyton Condis, a first-year graduate student in the Pitt's Counseling Program.
We're going to tell you about counseling's role in the DISCO program while we show you some of our counseling spaces here in the Wellness Pavilion. So we at the Pitt Counseling Program are committed to student-led programming here at the Wellness Pavilion. It is just so important that our counseling students get out of the classroom and into the community. One of the things that we know is that counselors can do so much good, and counselors can be so important in helping individuals develop positive and healthy routines, such as what we'll be doing in the DISCO program.
Counseling students will lead discussions and provide evidence-based practices on dealing with challenging emotions, coping with stress, sticking to routines, and implementing new healthy habits for those living with diabetes.
Physical therapy is a part of the larger interprofessional team working here at the Wellness Pavilion. As part of DISCO, we work with clients to enable them to better play a part in their own health and understand the risk factors as it relates to type 2 diabetes. DPT students like Marie help guide clients to understand the risk factors associated with type 2 diabetes and provide resources and materials to help promote proper foot hygiene and health awareness. During this session, clients will learn how to perform a self-examination in order to manage and prevent infection and identify other foot-related problems that can occur in individuals with diabetes. Regular physical activity can help control body weight, lower the risk for heart disease, reduce stress, and improve insulin sensitivity. These are all positive health outcomes that contribute to the successful management of diabetes. In addition to education on diabetic foot screening techniques, DISCO participants will have the opportunity to learn about the benefits of movement while sampling different types of physical activities led by physical therapy students. Physical therapy students like Katina will guide clients in various physical activities and provide resources to promote participation in individualized and sustainable home programs. Physical therapy students and faculty are trained and well prepared to work with individuals who have diabetes. We are excited to offer this comprehensive program as part of the DISCO team.
The nutrition and dietetics students, like myself, are working under the supervision of Professor Passarello to develop interactive, engaging, and personalized nutrition lessons. We, the graduate students, will be delivering the content too.
Each session of the program will include an opportunity to make and taste food that supports the topic for that day. We know that adults, just like students, retain more of what they learn when they are interested and actively involved in their learning.
From the reports provided to us, we know that our participants are really interested in learning how to eat in a way to manage their diabetes and also lessening the sodium in their diet. It is of the utmost importance to us that we are teaching food and recipe skills that our participants love while also fitting within their skill level and their budget.
The space is able to maintain hands-on learning even while we need to maintain social distancing. Participants will be able to view what's going on in the kitchen and take turns being in the kitchen or in the audience.
Welcome to Medication Education and Wellness Center, otherwise known as MedWell, brought to you by Pitt Pharmacy. We're so excited to engage with the community and share our new space with you. As part of the DISCO program, the School of Pharmacy will focus on the key role that medication therapy plays in the management of diabetes. So come on in. We have 2 private spaces in the center where we can meet with visitors one-on-one. And we plan to offer both scheduled and walk-in appointments for medication management as well as healthcare navigation. Most of the DISCO classes will take place upstairs in the Wellness Pavilion, but we might identify participants within DISCO that may benefit from some more targeted medication management. So we can meet with those folks in our private spaces here. We also have a larger space that's set up with technology that will allow for group programming as well. As you've seen on our conference table, we have a few items that highlight how we can interact with DISCO participants to help improve their medication adherence as well as their disease state monitoring. We also have initiatives that focus on medication safety and over-the-counter medication use. So if needed, MedWell can also offer programming for a variety of age groups.
So you've already learned a little bit about the DISCO program, which is designed to help community members better understand their diabetes and how to manage it day to day. As pharmacists, we understand how complicated self-management of diabetes can be, and we frequently answer questions related to medication use. To help address these concerns, we've partnered with the health science students from the University of Pittsburgh, including physical therapy, nutrition, and counseling, to create 15-minute lessons, content, and interactive activities tailored to meet your needs. During these sessions, we can discuss important topics such as using diabetic supplies, healthy lifestyle tips, and managing medications. We will discuss problem solving and coping skills to better understand what these topics mean, why they are important to you, and what you can do about it. Sessions will be personalized to fit the group members' needs so that you're always getting the most of your time.
We're committed to student-led initiatives because we recognize that working with the community helps to develop future healthcare providers who are inclusive and empathetic. Our interprofessional partnership with the School of Health and Rehab Sciences highlights how various disciplines can work together to meet the needs of the community. It's important to us that we offer programming that's relevant, so members of our team will be speaking with each DISCO participant prior to the start of the program to tailor our class sessions appropriately. At MedWell, we plan to interact with visitors to answer questions, provide resources, and coordinate long-term plans to improve medication use and access. As you've seen in the DISCO program, partnering with other disciplines will allow us to do this in a collaborative, innovative way. We're so excited to start this program and look forward to meeting with the community very soon.